Hey there, future CNAs, ready to level up your skills and confidence. This video is. Question 1. What is one important reason why the bed should remain wrinkle-free? A. To improve the aesthetic look of the room. B. To make it easier to change sheets later. C. To help keep the skin healthy and prevent pressure sores. D. To keep the resident from sliding down. The correct answer is to help keep the skin healthy and prevent pressure sores. Wrinkles in sheets can cause friction and shearing, leading to skin breakdown and pressure sores. Question 2. What is the term for a device that replaces a missing body part? A. Pronation. B. A prosthesis. C. Orthosis. D. Abduction pillow. The correct answer is prosthesis. A prosthesis is a device designed to replace a missing body part. Question 3. To convert 4 ounces of water to milliliters, ml, the nurse assistant should multiply 4 by A. 10b, 15c, 30d, 60. The correct answer is 30. 1 ounce is equal to 30 ml. Therefore, multiply ounces by 30. Question 4. Which of the following healthcare settings is for people who will die in 6 months? A. Acute care hospital. B. Rehabilitation center. C. Hospice. D. Assisted living. The correct answer is hospice. Hospice care is specifically designed for patients with a terminal illness and a prognosis of 6 months or less. Question 5. Which of the following abbreviations means nothing by mouth? A. NBMB. NPOC. NPMD. No. The correct answer is NPO. NPO stands for nil per os, which is Latin for nothing by mouth. Question 6. Exercises that put each joint through its full arc of motion are called A. Aerobics. B. Weight training. C. Range of motion. D. Rotation therapy. The correct answer is range of motion. Range of motion, ROM, exercises ensure joints remain flexible and mobile. Question 7. What is the medical term for high blood pressure? A. Hypotension. B. Tachycardia. C. Bradypnea. D. Hypertension. The correct answer is hypertension. Hypertension is the medical term for high blood pressure. Question 8. What is a task that is outside the scope of practice for a CNA? A. Feeding a resident. B. Inserting tubes into a resident's body. C. Bathing a resident. D. Taking vital signs. The correct answer is inserting tubes into a resident's body. NAS are not licensed to perform invasive procedures like inserting tubes, sterile technique. Question 9. Standard precautions should be practiced, A. Only on residents with known infections. B. On every single person in your care. C. Only when the nurse instructs you to. D. Only during flu season. The correct answer is on every single person in your care. Standard precautions must be used with every person to prevent the spread of infection. Question 10. Which kind of care helps restore a resident to the highest level of functioning possible? A. Palliative care. B. Hospice care. C. Rehabilitation. D. Acute care. The correct answer is rehabilitation. Rehabilitation focuses on restoring function and independence. Question 11. If an activity is not listed on the care plan, what is the responsibility of a NA? A. Task the resident if they want to do it. B. The NA should perform it if they have time. C. The NA should not perform the activity if it is not listed on the care plan. D. Call the family for permission. The correct answer is the NA should not perform the activity if it is not listed on the care plan. The care plan is the legal guide for care. Unauthorized activities should not be performed. Question 12. Restraints can be applied, A. Whenever the staff is too busy to monitor the resident. B. To prevent the resident from wandering. C. Only with a doctor's orders. D. If the family requests them. The correct answer is only with a doctor's orders. Restraints are a last resort and strictly require a physician's order. Question 13. Generally, the last sense to leave a dying person is the sense of A. Sight. B. Touch. C. A smell. D. A hearing. The correct answer is hearing. Hearing is widely believed to be the last sense to remain active during the dying process. Question 14. What is a normal range of a blood pressure? A. 119/75 is an example. B. 140/90 or higher. C. 90/60ths or lower. D. 150/100 is an example. The correct answer is 119/75 as an example. A normal blood pressure is typically around 120/80. 119/75 falls within the normal range. Question 15. Incontinence may be caused by A. Drinking too much water. B. Eating too much fiber. C. Nervous system diseases. D. Walking too much. The correct answer is nervous system diseases. Nervous system diseases can disrupt the signals needed to control bladder or bowel function. Question 16. Standing with the legs shoulder width apart is using A. Poor posture. B. Good body mechanics. C. Standard precautions. D. Range of motion. The correct answer is good body mechanics. A wide base of support is a key component of good body mechanics. Question 17. After an amputation, a resident may experience phantom sensation. Phantom sensation is A. Mental illness. B. Pain or sensation caused by remaining nerve endings. C. A sign of infection. D. An allergic reaction. The correct answer is pain or sensation caused by remaining nerve endings. Phantom sensation is the feeling that the missing limb is still there, caused by nerve endings. Question 18. How should a fracture pan be positioned? A. With the handle toward the head of the bed. B. With the handle toward the foot of the bed. C. Sideways. D. Upside down. The correct answer is with the handle toward the foot of the bed. The handle of a fracture pan should point toward the foot of the bed. Question 19. What does palliative care involve? A. Curing the disease. B. A surgery and aggressive treatment. C. Pain relief and comfort. D. Physical therapy only. The correct answer is pain relief and comfort. Palliative care focuses on symptom management and comfort rather than curing the illness. Question 20. Nursing assistants do not usually perform procedures that require A. Gloves. B. Sterile technique. C. Documentation. D. Teamwork. The correct answer is sterile technique. Sterile procedures are typically outside the scope of practice for a CNA. Question 21. Insulin reaction, hypoglycemia, can be caused by A. Too much food, B. Too little food, C. Lack of exercise, D. High blood pressure. The correct answer is too little food. Skipping meals or eating too little after taking insulin can cause blood sugar to drop dangerously low. Question 22. Which of the following is a requirement of OBRA? A. Nursing assistants must have at least 75 hours of training. B. Nursing assistants must have a college degree. C. Nursing assistants must be registered nurses. D. Nursing assistants must renew certification every 10 years. The correct answer is nursing assistants must have at least 75 hours of training. OBRA mandates a minimum of 75 hours of training for nursing assistants. Question 23. What is a good way for a nursing assistant to care for a mentally ill resident? A. Avoid the resident. B. Tell them to snap out of it. C. Support the resident and his or her family and friends. D. Lock the resident in their room. The correct answer is support the resident and his or her family and friends. Support and empathy are crucial when caring for residents with mental illness. Question 24. When should sheets be changed? A. Once a week. B. Every morning only. C. Whenever they are soiled, wrinkled, or damp. D. Every hour. The correct answer is whenever they are soiled, wrinkled, or damp. To prevent skin breakdown and infection, sheets must be changed immediately if soiled or damp. Question 25. What does the chain of command do? A. Prevents employees from talking to each other. B. Describes the line of authority. C. Guarantees a pay raise. D. Assigns vacation time. The correct answer is describes the line of authority. The chain of command outlines who reports to whom and the line of authority. Question 26. What is a good way for a nursing assistant to respond to inappropriate sexual behavior? A. Scream at the resident. B. Take the resident to a private area. C. Laugh it off. D. Punish the resident. The correct answer is take the resident to a private area. Moving the resident to a private area maintains dignity and safety while redirecting behavior. Question 27. What should a nursing assistant do if she suspects a resident is being abused? A. Ask the resident if they are being abused. B. Confront the abuser. C. Ignore it unless there is proof. D. Report it to the nurse immediately. The correct answer is report it to the nurse immediately. Reporting suspicion of abuse is a mandatory legal requirement. Question 28. What is one good way a nursing assistant can assist residents with normal changes of aging related to the urinary system? A. Restrict fluids. B. Offer frequent trips to the bathroom. C. Use diapers on everyone. D. Insert a catheter. The correct answer is offer frequent trips to the bathroom. Offering frequent bathroom trips helps manage frequency and urgency associated with aging. Question 29. Which of the following is true of transmission-based precautions? A. They are used instead of standard precautions. B. They are practiced in addition to standard precautions. C. They are only for HIV patients. D. They are voluntary. The correct answer is they are practiced in addition to standard precautions. Transmission-based precautions are used with standard precautions for known infectious conditions. Question 30. What can nursing assistants do in regards to IVs? A. Change the 4 bag. B. Insert the 4 needles. C. Observe the 4 site for problems. D. Remove the 4. The correct answer is observe the 4 site for problems. NAS observe and report, they do not manipulate IVs. Question 31. Passive range of motion exercises are done A. by the resident themselves, B. when a resident cannot move on her own, C. during physical therapy only, D. only on the legs. The correct answer is when a resident cannot move on her own. Passive ROM implies the caregiver moves the joints because the resident cannot. Question 32. Which of the following is used when documenting the amount of fluid a resident drinks? A. Ounces, B. Cups, C. Milliliters, ml, D. Gallons. The correct answer is milliliters, ml. Medical documentation of fluids is done in milliliters, ml, or cubic centimeters, cc. Question 33. When encountering a fire, a nursing assistant should first A. pull the alarm, B. extinguish the fire, C. remove resident from danger, D. call the family. The correct answer is remove resident from danger. Follow the RACE acronym, rescue/remove residents first. Question 34. What is a common cliché used in healthcare that should be avoided? A. I am sorry for your loss, B. It will all work out in the end, C. Can I get you anything? D. How are you feeling? The correct answer is it will all work out in the end. False reassurance like it will all work out minimizes the patient's feelings. Question 35. What member of the care team might help a resident learn to use adaptive devices for eating or dressing? A. A physical therapist, B. Occupational therapist, C. Speech therapist, D. Social worker. The correct answer is occupational therapist. Occupational therapists focus on activities of daily living, ADLS, and adaptive devices. Question 36. A way to prevent aspiration during oral care of unconscious residents includes A. using plenty of water, B. positioning the resident on their back, C. using as little liquid as possible, D. pouring water into the mouth. The correct answer is using as little liquid as possible. Using minimal liquid prevents fluid from running down the throat and causing aspiration. Question 37. Providing privacy while giving care is a patient's A. privilege, B. reward, C. legal right, D. option. The correct answer is legal right. Privacy is a fundamental patient right protected by law, HIPAA/OBRA. Question 38. What is something a nursing assistant needs to observe and report regarding the musculoskeletal system? A. Dry skin, B. Hunger, C. White, shiny, red, or warm areas over a joint, D. Frequent urination. The correct answer is white, shiny, red, or warm areas over a joint. These signs over a joint can indicate infection or inflammation. Question 39. What is one way a nursing assistant can promote a resident's independence? A. Doing everything for the resident, B. allowing a resident to do a task by himself no matter how long it takes, C. rushing the resident, D. choosing the resident's clothes for them. The correct answer is allowing a resident to do a task by himself no matter how long it takes. Patience allows residents to maintain their skills and dignity. Question 40. To treat a minor burn, a nursing assistant should A. apply butter, B. apply ice directly, C. use cool, clean water, D. pop any blisters. The correct answer is use cool, clean water. Cool water soothes the burn, ice or grease can damage the tissue further. Question 41. For a nursing assistant, confidentiality means A. Sharing stories with family, B. Keeping private things private, C. Discussing patients in the elevator, D. Posting on social media. The correct answer is keeping private things private. Confidentiality protects patient privacy and is a legal requirement. Question 42. When leaving a residence room, a nursing assistant should A. Turn off the lights, B. Lock the door, C. Restock supplies and leave the call light within reach, D. Turn on the TV. The correct answer is restock supplies and leave the call light within reach. Ensuring the call light is reachable is critical for safety. Question 43. What should a nursing assistant do each time a patient is repositioned? A. Check the resident's skin, B. Give the resident a snack, C. Change the sheets, D. Take the blood pressure. The correct answer is check the resident's skin. Repositioning is the best time to check for early signs of pressure sores. Question 44. Which is the most essential nutrient for life? A. Protein, B. Carbohydrates, C. Water, D. Fats. The correct answer is water. Water is essential for all body functions and survival. Question 45. Which senses usually last to leave the body when a person is dying? A. Sight, B. Taste, C. Touch, D. Hearing. The correct answer is hearing. Hearing is generally the last sense to fail. Question 46. What is a function of the nervous system? A. Digesting food, B. Pumping blood, C. Senses and interprets information from outside the body, D. Filtering urine. The correct answer is senses and interprets information from outside the body. The nervous system processes sensory input. Question 47. During a seizure and nausea, should A. Restrain the resident, B. Put something in the resident's mouth, C. Keep the resident safe, D. Leave to get help. The correct answer is keep the resident safe. The priority is protecting the resident from injury, moving furniture, cushioning head. Question 48. The ability to think logically and quickly is called A. Cognition, B. Dementia, C. Aphasia, D. Dysphagia. The correct answer is cognition. Cognition refers to mental processes like thinking and reasoning. Question 49. How can a nursing assistant help residents with their spiritual needs? A. Preach to them, B. Tell them their beliefs are wrong, C. Learn about residents' beliefs and listen carefully, D. Ignore the topic. The correct answer is learn about residents' beliefs and listen carefully. Respecting and listening to beliefs supports holistic care. Question 50. If a resident with Alzheimer's disease has problems with dressing, the nursing assistant should A. Address them immediately, B. Lay out clothes in the order they should be put on, C. Let them wear pajamas all day, D. Scold them. The correct answer is lay out clothes in the order they should be put on. Simplifying the task helps the resident remain independent. Question 51. What is a type of advance directive? A. A prescription. B. A durable power of attorney for healthcare. C. Care plan. D. Discharge summary. The correct answer is durable power of attorney for healthcare. A durable power of attorney appoints someone to make medical decisions if the patient cannot. Question 52. Which type of urine specimen does not include the first and last urine in the sample? A. A routine. B. A 24-hour. C. A clean catch. D. A stool. The correct answer is clean catch. A clean catch, midstream, collects the middle portion of the void. Question 53. Underscore 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 is maintaining equal intake and output. A. A dehydration. B. Fluid balance. C. Edema. D. Retention. The correct answer is fluid balance. Fluid balance means the amount of fluid taken in equals the amount lost. Question 54. How should a resident with chronic obstructive pulmonary disease, COPD, be positioned? A. Lying flat. B. Lying on the stomach. C. Sitting upright. D. With legs elevated. The correct answer is sitting upright. Sitting upright, orthopneic position, helps expand the lungs and aids breathing. Question 55. The first sign of skin breakdown is A. A bleeding. B. Open wound. C. Pale, white, reddened, or purple skin. D. Black scab. The correct answer is pale, white, reddened, or purple skin. Discoloration that doesn't go away is stage 1 of a pressure sore. Question 56. The single most important thing you can do to prevent the spread of disease is to A. Wear a mask. B. Wash your hands. C. Take vitamins. D. Avoid patients. The correct answer is wash your hands. Hand hygiene is the number one way to prevent infection. Question 57. Which temperature site is generally considered to be the most accurate? A. Oral. B. Axillary. C. Rectal. D. Tympanic. The correct answer is rectal. Rectal temperature is closest to core body temperature. Question 58. What may influence a food preference? A. Height. B. Hair color. C. Religion. D. Shoe size. The correct answer is religion. Religious beliefs often dictate dietary restrictions, example, kosher, halal. Question 59. A underscore 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 is the permanent and painful stiffening of a joint and muscle. A. A fracture. B. A contracture. C. A sprain. D. A strain. The correct answer is contracture. Contractures occur when muscles shorten and freeze in position due to lack of movement. Question 60. Diabetes can lead to what complication? A. Improved vision. B. A stronger bone. C. Impaired wound healing. D. Better circulation. The correct answer is impaired wound healing. High blood sugar damages blood vessels, slowing the healing process. Question 61. Where should the call light be placed when a nursing assistant leaves a resident's room? A. On the bedside table. B. On the chair. C. Within the resident's reach. D. By the door. The correct answer is within the resident's reach. The call light must always be accessible for safety. Question 62. Why should a nursing assistant be concerned if he notices that areas of a resident's skin have become pale, white, or a reddened color? A. It is a sign of fever. B. It could be the beginning of a pressure sore. C. It is a normal sign of aging. D. It means the resident is cold. The correct answer is it could be the beginning of a pressure sore. These are early signs of tissue damage from pressure. Question 63. What can an overbed table be used for? A. Is storing dirty linens. B. Placement of meals. C. Sitting on. D. Is storing urinals. The correct answer is placement of meals. Overbed tables are clean areas used for food and personal items. Question 64. Pressure sores can lead to A. Improved skin health. B. Life-threatening infection. C. Better circulation. D. Muscle growth. The correct answer is life-threatening infections. Open sores can become infected, leading to sepsis. Question 65. If a resident starts to fall, the best thing a NOT can do is to A. Try to hold them up. B. Run away. C. Widen her stance and bring the resident's body close to her. D. Scream for help. The correct answer is widen her stance and bring the resident's body close to her. This technique allows the NOT to lower the resident safely to the floor without injury. Question 66. 10 ounces is equal to milliliters, ml. A. 100. B. 200. C. 300. D. 400. The correct answer is 300. 10 ounces x 30 ml /us equals 300 ml. Question 67. An attitude that is helpful in hospice work is A. Pity. B. Respect privacy and independence. C. Cheerfulness at all times. D. Detachment. The correct answer is respect privacy and independence. Respecting dignity is crucial in end-of-life care. Question 68. If a resident with Alzheimer's disease shows violent behavior, the nursing assistant should A. Yell back. B. Restrain them. C. Remove triggers. D. Ignore them. The correct answer is remove triggers. Removing the cause of agitation, trigger, is the most effective nonviolent intervention. Question 69. In which of the following procedures must a nursing assistant always wear gloves? A. Feeding a resident. B. Brushing hair. C. Shaving. D. Walking a resident. The correct answer is shaving. Shaving carries a risk of exposure to blood. Question 70. What thermometer is used to take a temperature from the ear? A. Oral. B. Rectal. C. Axillary. D. Tympanic thermometer. The correct answer is tympanic thermometer. Tympanic refers to the eardrum. Question 71. HIV can be transmitted A. by hugging B. by sharing a toilet C. to a fetus by an infected mother D. through the air. The correct answer is to a fetus by an infected mother. HIV is bloodborne and can pass from mother to child. Question 72. When assisting a resident with a standard bedpan, where should the wider end of the bedpan be placed? A. Under the knees. B. In alignment with the resident's buttocks. C. Toward the feet. D. Under the lower back. The correct answer is in alignment with the resident's buttocks. The wider end goes under the buttocks for proper alignment and comfort. Question 73. The artificial opening in the abdomen of a resident with an ostomy is called A. Stoma. B. Fistula. C. A vent. D. Port. The correct answer is stoma. The stoma is the visible part of the bowel on the abdomen. Question 74. Which is true about nursing assistants in catheters? A. NAS insert catheters. B. NAS remove catheters. C. NAS observe and report regarding catheters. D. NAS flush catheters. The correct answer is NAS observe and report regarding catheters. Catheter insertion and removal are sterile procedures usually done by nurses. Question 75. Which of the following statements is true of pain? A. Old people don't feel pain. B. Pain is the same for everyone. C. Pain is a different experience for each person. D. If they are sleeping, they are not in pain. The correct answer is pain is a different experience for each person. Pain is subjective, what the patient says it is. Question 76. What is a guideline for good skin care? A. Wash with hot water. B. Check the resident's skin daily and report changes. C. Scrub vigorously. D. Use alcohol to clean skin. The correct answer is check the resident's skin daily and report changes. Daily observation is key to preventing pressure ulcers. Question 77. When a resident has left-sided weakness, which sleeve should be put on first? A. Right sleeve. B. Left sleeve. C. Both at once. D. It doesn't matter. The correct answer is left sleeve. Dress the weak side first, undress the weak side last. Question 78. With whom may a nursing assistant share a resident's medical information? A. The resident's roommate. B. The NAS family. C. Other staff members involved in the resident's care. D. Visitors. The correct answer is other staff members involved in the resident's care. HIPAA allows sharing only with the care team. Question 79. How many rubber-tipped feet does a quad cane have? A. 1B, 2C, 3D, 4. The correct answer is 4. Quad means 4. Question 80. If a nursing assistant sees a letter for the resident at the front desk, she should A. Open it. B. Throw it away. C. Take the open letter to the resident's room. D. Take the unopened letter to the resident's room. The correct answer is take the unopened letter to the resident's room. Mail is private property and must be delivered unopened. Question 81. Where should the nursing assistant stand when helping a resident who is recovering from a stroke to walk? A. On the resident's stronger side. B. On the resident's weaker side. C. In front of the resident. D. Behind the resident. The correct answer is on the resident's weaker side. Support the weak side to prevent falls. Question 82. When communicating with a resident who is visually impaired, the nursing assistant should A. Speak loudly. B. Use hand gestures. C. Tell the resident what the nursing assistant is doing while caring for him. D. Turn on all lights. The correct answer is tell the resident what the nursing assistant is doing while caring for him. Verbal explanations replace visual cues. Question 83. A nursing assistant should wear gloves when A. Feeding a resident. B. Giving perineal care to a resident. C. Touching a resident's arm. D. Making a clean bed. The correct answer is giving perineal care to a resident. Perineal care involves potential contact with body fluids. Question 84. In order to communicate with a resident who is hearing impaired, the nursing assistant should A. Shout. B. Speak normally. C. Face the resident directly when speaking. D. Whisper. The correct answer is face the resident directly when speaking. Facing the resident allows them to read lips and see facial expressions. Question 85. Before helping a resident eat, how should the nursing assistant position the resident? A. Lying down. B. Recline. C. Sitting as upright as possible. D. On their side. The correct answer is sitting as upright as possible. Upright positioning prevents choking and aspiration. Question 86. When speaking with residents, nursing assistants should A. Use medical slang. B. Use simple, non-medical terms. C. Speak as fast as possible. D. Use baby talk. The correct answer is use simple, non-medical terms. Clear communication requires language the resident understands. Question 87. To prevent falls, a nursing assistant should A. Wax the floors. B. Keep walkways free of clutter. C. Dim the lights. D. Leave shoes untied. The correct answer is keep walkways free of clutter. Clutter is a major trip hazard. Question 88. Which position is a resident in if he is lying on his stomach? A. Supine. B. Lateral. C. Prone position. D. Fowler's. The correct answer is prone position. Prone means lying face down. Question 89. When assisting a patient with dentures, a nursing assistant should A. Use hot water. B. Clean dentures and store in a labeled denture cup. C. Leave them on the bedside table. D. Use bleach. The correct answer is clean dentures and store in a labeled denture cup. Proper storage prevents loss and damage. Question 90. When providing perineal care for a female resident, the nursing assistant should A. Wipe from back to front. B. Wipe from front to back. C. Wipe in a circle. D. Use the same part of the washcloth. The correct answer is wipe from front to back. Wiping front to back prevents bringing bacteria from the rectum to the urethra. Question 91. When observing catheters, a nursing assistant should be sure that A. The drainage bag is on the floor. B. The drainage bag is kept lower than the hips or bladder. C. The tubing is kinked. D. The bag is full. The correct answer is the drainage bag is kept lower than the hips or bladder. Gravity drains urine, raising the bag causes backflow and infection. Question 92. Which member of the care team diagnoses disease and prescribes treatment? A. Nursing assistant. B. A physical therapist. C. Physician. MD. D. Dietitian. The correct answer is physician, MD. Only the physician, or NP/PA, can diagnose and prescribe. Question 93. A resident's protected health information, FI, may be shared with A. Reporters. B. The resident's neighbors. C. Only those who need the information for care or processing of records. D. Anyone who asks. The correct answer is only those who need the information for care or processing of records. Privacy laws restrict access to only those directly involved in care. Question 94. What is an example of physical abuse? A. Yelling at a resident. B. Pinching a resident. C. Ignoring a resident. D. Stealing from a resident. The correct answer is pinching a resident. Pinching causes physical harm. Question 95. What is the correct conversion of 4:10 p.m. to military time? A is 0410 hours. B 1410 hours. C 1610 hours. D 1510 hours. The correct answer is 1610 hours. Add 12 to the hour for PM times. 4 plus 12 equals 16. Question 96. Joking with a resident's roommate about the resident's incontinence is what type of abuse? A. Physical abuse. B. Psychological abuse. C. Financial abuse. D. Sexual abuse. The correct answer is psychological abuse. Humiliation causes emotional and psychological harm. Question 97. What is the correct conversion of 1900 hours to standard time? A. 9 p.m. B. 7 a.m. C. 7 p.m. D. 5 p.m. The correct answer is 7 p.m. Subtract 12 from 19. 19 to 12 equals 7 p.m. Question 98. When should a nursing assistant identify a resident? A. After the procedure. B. Before helping with feeding or procedures. C. Only when giving meds. D. When the resident looks different. The correct answer is before helping with feeding or procedures. Identification prevents errors before any care is given. Question 99. What is an example of a normal change of aging? A. Incontinence. B. Dementia. C. Weaker muscles. D. Pressure sores. The correct answer is weaker muscles. Muscle mass naturally decreases with age, sarcopenia. Question 100. When using a transfer belt, the NA should A. Place it over a resident's clothing. B. Place it against bare skin. C. Leave it loose. D. Buckle it in the back. The correct answer is place it over a resident's clothing. Placing it over clothing prevents skin shearing and friction.